Good morning, everyone. The time is now 9:55 a.m. Welcome to the joint meeting of the Brooklyn Family Support Service Advisory Council and the Brooklyn Developmental Disabilities Council. First of all, hope everyone is doing well. I hope everyone survived from the storm yesterday, but today is a different day, a new day, and sunny and cool. Hope everyone is staying warm and hope everyone's doing well. Before we start our regular routine, as a reminder to everyone, housekeeping rules is very important. First of all, everyone should be muted. No one should be unmuting themselves or show any disrespectful when a speaker is speaking, including our speakers today. We remind everyone to please have the courtesy, the respect to any speaker who is speaking today. So I'd like to remind everyone, as you're entering the meeting, immediately always mute yourself in the microphone. The microphone, as you see on the screen, is there. We remind you to please keep your microphones muted. If you have a question, please raise your hand. The hand raise is available. And we remind everyone of all courtesies and in meetings to please mute yourselves so there's no echoing, no noise sound. So therefore, we can make sure everyone can hear themselves. And to remind you, the transition scripts are duty noted. So anyone says a certain word, which I'm not going to say, please be careful what you're saying, because we do not want to hear any foul language, no disrespectful to the speakers, or any chairperson or vice chairs at all. We have to show the courtesy and respect to anyone. This meeting is a very tight agenda. We're reminding everyone to please put your comments into the chat, as well as raise your hand if you want to say something. The hand raise is available, as you see on the screen. So let me move on. And I remind everyone, please keep your microphones on muted at the same time. So I am going to move on, and I'm going to ask someone to raise their hand or can unmute themselves. I'd like to make a motion for the minutes and the recording minutes for February 15th, 2023. And a reminder, the minutes are available on our website. It was sent out last week. Please always, everyone, check the minutes on our website, which is there for a reason, and we want to make sure everyone gets it. So I do need a motion for the joint meeting minutes.
I'll make the motion, Chris.
Thank you, Joyce. I need a second.
I'll second it, Chris.
Loud and clear, Ann. Thank you. Minutes passed. And I remind you, the minute joint meetings are on the website, as you see on the screen. And as I move on, as we keep our schedule on top, this is the agenda for today. There was a change in the agenda at this moment because Richard, which will be joining us in just a second. Okay. Excuse me. Can we please keep the microphones muted and please keep your words noted? Thank you. Thank you. As I repeat again, the agenda was adjusted. So at this moment in time, I'm going to ask Richard Bott. I'm sorry, because every guy got me a little cookie kook. So I'm just going to fix the agenda a little bit. And I apologize because my agenda thing just went a little off. So I'm going to ask Richard Bott to do his report. And then we'll go to the both chairperson's report, then OPWDD. Richard, you there?
I am here. And I'm Richard Botch from IAC, and I apologize for having to change the order of the agenda, but I have a 10 o'clock meeting of our residential committee at IAC, so I can spend maybe about 10 minutes with you guys, which I always enjoy.
He doesn't hear me either.
And
sorry, Richard. Can you please unmute yourself? I apologize.
let me do it.
I didn't do it.
Okay.
It's somehow. I'm sorry about that.
Okay, so what did you miss? I don't know. Anyway, so just to repeat that I apologize for having to move the agenda around. I have a 10 o'clock meeting with the IAC's residential committee. So I'll be here about maybe 10 minutes. I also will probably be back every month to Brooklyn and the other DD councils. The one important announcement, as most of you know, on Apple TV tonight's the return of Ted Lasso, another season. For those of you who, yeah, Jason, you're shaking your head and smiling. Can't wait. For those of you who don't know Ted Lasso, get Apple TV. It's only $4.95 a month. You'll enjoy it. Chris also asked me to just quickly go through the new titles of people at IAC. As you know, Winnie Schiff is now the new CEO of IAC. She's been making some changes. Nothing substantial functionally, but we're all taking on more. Chris Trieber, our education expert and main advocate, his new title is Chief of Innovation and Strategy Officer. Mary Knox is the Chief Program Officer, and I am the Chief of Staff, which sounds powerful. The other thing I just wanted to note, and in case I imagine most people know, but since you haven't had a meeting since then, Judy Heumann passed away on March 4th. She was known as the mother of the disabilities rights movement. She was our keynote speaker at the conference last year. I may have mentioned in a past meeting that if you don't know Judy, you know the work she did. There is a documentary on Netflix called Crip Camp. It's about her time at Camp Jened, which I know a lot of Brooklyn people went to when it was still open. It closed back in, I think, 76 or 77. 1976 or 77 for you youngsters. But she really was the leader of the American Disabilities Act. She conducted a sit-in the California State House until the law was signed. She was one very incredible person. So she's going to be greatly missed. And if you get the chance, if you haven't watched it, watch Crip Camp, and it'll make you proud to be part of the movement you're still part of. Let's see, I just also want to announce that IAC's annual conference will be back in person this year on June 7th and 8th. And this year it's going to be at the UJA Conference Center on 59th Street, catty corner to Bloomingdale's for all of you who shop Bloomingdale's. Again, it's in person. It's 2 days.
It's in the circle.
Good
It's in the
speakers,
circle.
line
It's on the
up.
left.
Yeah. And Chris, you got to mute yourself.
Sure.
So the lobbying continues, as you all know, and thank you everybody who's been participating in the different lobbying events, either in person or virtually. Special shout out to all the parent groups, including New York City Fair, who have been participating. We're still fighting for the 8.5% COLA. I'm not sure where it's going to end up, but we're still all over it. We're also looking for the DSP wage enhancement, which would add $4,000 to a DSP's salary. So we're still fighting for that. The other thing is that we'll get more information out on it, but the public health emergency ends on May 11th. And 60 days after that, is it 60 days? I don't know, it'll be 90 days after that, the flexibilities end. So we'll see where the details of that as we go along. I imagine there'll be more webinars by OPW. The one thing that's been mentioned about is ComHab-R in the residences. will only be available to people who are elderly, medically frail, or with severe behavioral issues. But more to come on that. The
Richard?
other good news, yes.
Hi, it's Brian. Wasn't it 6 months after?
6 months. That's
You
not
just
what
said
I
60
said.
days or 90 days. Wasn't it 6 months?
Yeah, 6 months. Thank
Okay,
you.
just double checking.
Thanks, Brian. Yeah, no, I've got this head cold. It's got my brain all in a tither. So please excuse me. And you can say rude and horrible things about me. I don't care what Chris said. You can curse too if you want. Okay, then we just got news about a week or so ago about the healthcare worker bonus has now been extended to the maintenance staff and clinical staff. This was known as the 100 and 300 series DFR. So that was more good news that the healthcare worker bonus can be given to more people. So finally, I think I just want to mention the an education world, and there's a lot of effort going on there. Chris has been working, Chris Treber at IEC has been working closely with State Ed and the Board of Ed. But the latest data is that and this is just IAC data, that 88 4410 or preschool classrooms are now closed. And 46 school age classrooms have now closed only because there are not enough staff. There are plenty of children waiting for services. The preschool seats that are waiting to be filled, number of kids waiting is somewhere between 814 and 1,740. You can't get the direct statistics out of the Board of Ed anymore, but there's just all these children with IEPs who are not getting services. As far as teacher vacancies, the turnover rate of IHC providers, 22%. And that's just, again, no, I'm sorry. Yeah, it's 22%. And of the school age programs, that is a 22% turnover. So it's the school world is not getting any better yet. We've made progress. The state budget does include money for State Ed to create a new rate setting system, which has been a major problem of increasing salaries and payment to the preschools and school age programs so they can hire more people. But we'll see how that goes. So I think that's all I have. In case anyone has any questions. If not, I'll be back. Yep.
Sorry, Richard. Just checking with Deborah or Joyce. Do you guys have any questions?
No, Chris, thank you.
Deborah?
Okay.
Vice.
Have a good rest of your meeting.
Hold on,
And,
Richard. Richard, this is Chris. Hold on one second.
Yes.
I'm checking with Debbie also. Do you have a question for Richard? Because he has to run.
No.
Okay.
All right.
And
Again,
does anyone?
my apologies for having to run. I'll be back next month, and I'll be back without conflicts. So, have a good meeting.
Thank you. You too, Richard. Thank you. And as a reminder, if anyone has any questions for Richard, please leave it in the chat with us. Deborah, you're muted, so you can, you got to unmute and slow down. We got to move on to the because Richard has to run to a meeting. But Richard, everyone's saying congratulations to you, and we hope that with everyone's position, we hope it goes well this year. Thank you. Chair, we can't hear you. Go ahead.
Unmute me.
I don't control the mute button. That's you.
I'm good. Can you hear me? Can you hear me?
Yes.
Okay, fine. Good morning, everyone. I'm Deborah Greif, the chair of the Brooklyn Family Support Service Advisory Council and your state rep to the statewide Family Support Committee. I'm also co-chair on the Parent and Information Committee, as well as the secretary for this council. I'm going to give a quick report. We met last week, the family provider, and we discussed issues with the new reimbursement admin. And there are a lot of issues, and it's not completely finished. They're working on what's allowed and what's not allowed. I want to thank very much that we had Robin Mooney, Angela Blades, and Janet Davis, who all assisted us, and we appreciate all their help. So this is a work in progress. If you're not happy with what's going on with the reimbursement, please contact OPWDD. You can either go through the Advisory Council's website or go onto OPWDD's website and let them know what issues or problems you're having. We know for the families it's very hard, but we're sorry, but it's hard when changes come, and we understand with that. Also, the statewide meeting won't be until April 26th. And they are trying to have a conversation with the central office up in Albany with Commissioner Neifeld, as well as Abiba Kindo. And I'm not sure the other person, I think Alexis Davis. We will get back to everybody so you can all know next month what is going on. So with that, I have no further questions or report.
Joyce?
And
Good morning. Yep, I'm here. Can you hear me?
Yes.
Okay. Good morning, everybody, and welcome to the meeting. We appreciate you coming. I'd like to start off by having a brief discussion on the virtual legislative breakfast, which was held on March 3rd. First, I would like to thank Sandy Napor for speaking at the breakfast. So thank you very much, Sandy. We also would like to thank Matthew Estep for his invaluable assistance with the videos and assisting in putting together the presentation, and our own Rochelle Kivanowski, who's on this call, who moderated the breakfast. So thank you to everybody for your participation. It was a big success, and because of all of you. But we had over 500 people on the virtual breakfast, and it was good. We had some legislative people there. Unfortunately, nobody from Brooklyn was able to attend in terms of our legislators, but there were legislators from the other boroughs, and everybody agreed to support the 8.5% increase for staff, and as well as the $4,000 direct care DSP increase. We really need that for us to be competitive in hiring DSPs. Right now, the DSPs that work for not-for-profits make about 30 to 40% less than the DSPs that work for OPWDD, and there's a big disparity there, and we need that to be made right. We have gotten word that the 8.5% is definitely being supported by both houses. We're not sure about the $4,000 increase, but we will continue to fight for that because it's so important. I just saw Sandy put up something in the chat. Yes, it is available. The recording of the breakfast is available. I think it is on our website, but I know it is available. Mm-hmm.
Joyce,
It's on
this is Chris.
Website.
Yes. Joyce, this is Chris. Just to let everyone know that it's been on the email, same time was out of the minutes. It is, as you see on the screen, Sandy, it's on our website. It is on the homepage, so everyone can click on it and watch the video as well.
Thank you, Chris. As Richard had mentioned, the crisis in the school programs are exacerbated, and the same with the adult programs, residential and day. And we continue to have a staffing crisis, being able to ensure everyone's health and safety. And that really is the prime concern. So we need these salary enhancements and increases just to be able to remain competitive with Target and McDonald's, believe it or not. There is a statewide rally on March 23rd, next Thursday in Albany. There will be a number of people going up from the different boroughs. There was a rally this past Friday in Staten Island. There were actually statewide rallies. Long Island had rallies as well as upstate. And these got good coverage. You had some of the assembly and speakers, representatives came and spoke at the rallies, again, in support of the increases that we're looking for. And we just need to continue. So if you have an opportunity to speak with your legislators, please push for the 8.5% increase and the $4,000 direct care enhancement to their salary. It's so important at this point right now. So I appreciate that. And just one other thing I wanted to mention was that we will be having elections coming up in June. We will send out further information on that, on the elections for June. And that's it. I wanted to be quick so we could keep the agenda moving forward. Thank you, Chris.
Not a problem, Joyce. And just before we go to OPW report, does anyone have any questions for Joyce or Deborah at this time? Otherwise, we're going to move on to the Brooklyn DDRO. And I'm just going to double check the chat quick, and then we can move on quick.
I guess it'll be showing you. Yeah.
Lucy, we can hear you. This is Chris. I can hear you. And I'm sorry, Nina.
Yes, good morning. This is actually Nina. I have a computer problem this morning. So I'm occupying Lucy's desk and Lucy's computer, but she's here on the side. And how's my sound? I think it's good.
Loud,
because it's not my computer.
Yeah, it's loud and clear.
Okay, very good. So I have some information. I think you already had the updates about the upcoming budget, but I still want to talk about this today. And since OPWDD, we have the official points that we can talk about, and I want to share some information with the group this morning. The proposed executive budget. Okay, so Governor Hochul, again, shows her commitment to improving the overall quality, availability, and cost effectiveness of community-based person-centered services for people with developmental disabilities within this year's proposed budget. There are a number of the targeted investments in OPWDD that will address critical needs and support policy reforms. You probably heard that the proposed budget includes a 2.5% COLA for provider agencies, which builds on the 5.4% COLA provided in the last year budget. This is the first time a governor has provided a back-to-back COLA investments in more than a decade. And combined, these investments will provide more than $700 million towards increased costs, including staff wages. The executive budget continues to expand independent living opportunities for people with developmental disabilities. We are committed to additional $15 million to develop community-based housing. This is in addition to the funding that is part of the 5-year $20 billion affordable and supportive housing plan through the Empire State Supportive Housing Initiative, that is also known as ESHI. The budget also provides legislation that would allow people with developmental disabilities and their family, once approved by a nurse, to train support staff to administer medication and perform other simple nursing tasks. And that would give more flexibilities and opportunities for the individuals to remain or transition in more independent settings. The budget continues the commitment to expand needed crisis services for people with developmental disabilities and those who are dually diagnosed. OPWDD will be working closely with Office of Mental Health to ensure that the investments in mental health will benefit people with mental health within our system of support. That continues in this year's executive budget, which calls for additional $11.7 million in capital funding to create additional intensive treatment opportunities at the former Finger Lakes Developmental Center campus. And this will provide much needed support for people with complex needs. The governor's budget also calls for establishing a statewide ombudsman program, which will provide advocacy support for people who are eligible for OPWDD services. The independent advocate would help people navigate the service system and resolve disputes. The budget continues to support ways to make a competitive employment available for people with disabilities, continuing the investments in the last year budget, and OPWDD will soon be awarding grants to providers to fund career-specific vocational training opportunities to help people prepare for employment. Proposed Article 7 budget legislation would create more opportunities for people with disabilities to work in state government by amending the 55B and 55C sections of the Civil Service Law to expand the number of positions available and to give employees in those positions the opportunity to transfer into competitive class positions. The executive budget also proposes to expand the Medicaid buy-in program and to increase the eligibility limit from 250% of the federal poverty level to 2,250%. It also exempts income from responsible relatives from the eligibility calculation. So I think it's a big change for Medicaid recipients. This would allow more people to pursue employment without having to worry about losing their Medicaid benefits. And some other provisions in the budget. As part of the budget, the Medicaid rates for oral health would be increased, making it more possible for dentists to spend the necessary time with the patients with developmental disabilities. And New York State DOH, Department of Health, posted their webinar slides that describe this proposal in detail on its this information would be on DOH website. The proposed budget includes $1 million in funding over a 2-year period for independent study of how the Institute of Basic Research in Developmental Disabilities aligns with OPWDD's strategic goals and the feasibility of revitalizing the facility. And the budget continues to invest $60 million in new state resources, support OPWDD priority program reforms, and ensure that people receive the services they need. And that is it for me for the budget update.
Nina, just to let you know, first of all, I want to apologize. I was trying to text you, but everyone was texting me at the same time, trying to focus on getting to your attention. But I want to remind people that the reason is I'm not the only one you should be texting. I have to make sure that you, Nina, Richard, Joyce, Deborah, Brian are also getting on, and the speaker. So, guys, there are times you have to give me a chance to respond. But everyone at the same time texting me, it does get overwhelmed. So right
Busy
now, I'm gonna-
morning.
thank you. Thank you for saying that word, because I've been trying to text you, but every time I'm texting you, everyone's going berserk. So I just wanted to let you know I was trying to text you, but then when I saw you on the screen with Lucy, and then I said, okay. But I know Deborah has a question for you, and I know Joyce may have a
Yeah.
question.
Can you hear me?
Yes?
Okay, good. Okay, first, Nina, thank you very much for about the budget. There's one thing that has not been added, and I do know when we were updated the advisory councils from Central, the governor has put in that meetings that are especially statewide meetings, because as you know, parts of the state have been snowed in, terrible storms, or also because many of them, their children have medical frailties besides their development disability. So that the governor is understood, and we're trying to ask every legislator to vote that statewide meetings, even local meetings, if the person has to do it in their home, it is still counted as a quorum, because of the difficulties of sometimes you can't just get to the meeting in person, and they go on and off with the state of emergency. But we want this we want this put in writing, because also this help affects not just the statewide Family Support Service Advisory Council, the statewide Developmental Disabilities Council. So that's one thing we want to add in. So, and I appreciate what you're saying about the budget. We're trying very hard and to get everything put through. So everybody, please advocate with the DD Council and the advisory councils.
Right,
And
and yeah.
Sure.
Yeah, and one thing that I guess I should add that the executive budget is aligned with the strategic plan that we set up for our agency, and we had the meetings last year. So this year, OPWDD, we are planning to have in-person meetings again, and we will be having forums in the summertime to discuss how OPWDD is meeting the needs and where we stand with the goals that we have put in front of us, right? And by the end of the year, we hope that we are going to have some data reports and benchmarks of the progress that we've made.
Yes, I do understand they're saying, but at the same time, certain councils, we don't have meeting spots too. The libraries that they may help us, but it'll try. I'm not saying anything's permanent, but also at the building at 88 Fountain Avenue, we would have to figure that out in the summer for the advisory council if we meet in person. But I'm also asked that we keep the virtual piece intact too, because sometimes some of our people that come to our meetings also have to be at 2 meetings at the same time. So we're going to just try to work this out. But I appreciate what you said, but we're also trying to do this for the members in statewide committees that live in the North Country, Syracuse, Rochester, the Buffalo area, because of when the weather hits them, it's bad and they can't get out. So we're trying, because I did speak to Lieutenant Governor Delgado when he came to open up the Ettingville station in Long Island, and he said he saw my points. So we just want to have the option of doing both with no repercussions for anyone. Okay. Thank you so much. If there's anybody else who has a question.
Before you do that, you got to make sure,
Yeah.
Joyce, do you have a question for Nina?
That's what I'm asking.
No, I don't. Thank you.
Okay.
Thank you.
Thank you. Thank you,
does-
Nina. I appreciate it.
Yeah, there is only one question in the chat. There was a question in the chat. And I think it's actually in the main chat, Nina, if you can respond to that question. Also, just to let one know, this meeting is always recorded, just to make that clear. All meetings have to be recorded, and it's duty noted. That's how we do the minutes from recording. And, I'm sorry, Nina, it came in around 2 minutes ago in the regular section.
I think it's more of a comment, and I
Yeah.
completely understand that we had so many years with limited funding, right? And people may not feel hopeful, right? But I'm staying optimistic that LPWDD will be able to achieve the goals that we put in front of us, because we are working really hard, right, to meet the needs of the individuals that we serve.
Thank you, Nina, for that. There is no other questions. And the answer to the other person's question regarding how to get the recording, all recordings are available on our website once the video is done. So just want to make that clear. Since there is no other questions, unless Brian, Joyce, Debbie, do you have additional questions? I guess not. So thank you, Nina. Nina,
Thank you.
oh, and again, Anita, I apologize, but doing four things is not easy.
Mhm. Completely understand. Thank you.
Not a problem. As we move on to our agenda, today we're going to be discussing the three CC. Today's topic, as thanks to Brian, is Brian's with me right now. Brian, Vice Chair, are you there?
Hi, good morning, everyone. So I just want to introduce our next presenters. We're very grateful to have representatives from ACA, Care Design, and Tri-County Care to come on and just give some updates and some a presentation on the overall role of CCOs and care managers, because I know that's often a question. There's been a lot of changes. So at this point, want to pass it over to the CCOs to present.
We'll start with ACA, since it's ABC order.
No,
Actually,
Chris, they have a joint presentation.
It's a
correct.
joint presentation. So all three, that presentation is combined.
Correct.
Okay.
Yes, this is
The-
Nicole Richardson. Hi, I'm Vice President of Care Management for the Brooklyn Queens region for ACA, and we did work collaboratively to come up with this presentation today.
And I'm switching right now to the other PowerPoint right now. So please give me a second as you can introduce the three CCOs. Should be coming on in just a second.
Thank you.
There we go. It's popping up on now on the screen.
Okay, I think that might not be the correct
This is
version.
the one I got.
Okay.
Can we share it, Chris? Would we
Yeah.
be able
Chris,
to
there was
share?
a second one sent out in that same email chain that was forwarded over.
I only got one. So if they want to, I can stop
Okay, but
sharing
yes,
here.
you guys can share it on your end as well.
I'll share it, Nicole. Okay.
Thank you.
There we go.
Okay. Thank you. Good morning. Once again, my name is Nicole Richardson. I'm the Vice President of Care Management at ACA of the Brooklyn Queens region. The three CCOs in the region did get together to put this presentation together today. And this is on the roles and responsibilities of a care manager. Today's agenda is the overview of CCO Health Home Care Management, CCO enrollment, responsibilities of the care manager, customer service, and other resources. And at the end, we will take all questions. And I will start with the overview of the CCO Health Home Care Management. The CCO-H8 stands for Care Coordination Organization Health Home. There are 7 CCO home health organization providers in New York State. The CCO home health care management model is focused on achieving positive health outcomes. CCO care managers provide coordination of healthcare, behavioral health, and developmental disability services. New York State implemented CCO health home care management in the OPW system in 2018. It replaced the former model known as Medicaid Service Coordination, MSC. This change was done to comply with federal law, which requires that care coordination be done in a conflict-free way. CCO-H8 enrollment is required in order to access HCBS waiver services and self-direction services. There are 2 types of care management, health home care management and basic HCBS plan support. For those who need the robust services, the following are the things that we provide: develops care plan and reviews biannually, monitors health and safety, coordinates access to behavioral health services, coordinates access to medical and dental services, identifies community-based resources, uses technology to link your services, connects your care providers, takes burden of navigating systems from families and individuals, and anticipates future needs. For those who just require the basic service, what they will receive is develop the care plan and reviews biannually and monitor health and safety from the care manager. The 6 core services of health home care management are comprehensive care management, health promotion, transitional care, individual and family support, community and social support services, and use of health information technology to link services. The role of the care manager. The care manager is there to advocate for member health and wellness, facilitate the life plan development, apply for waiver services, collaborate with providers, maintain a comprehensive record, monthly contact and communication, problem solve when crises arise, and communicate OPWDD projects. And I will pass this over to my colleague over at Care Design.
I needed to unmute myself, so I'm going to share the screen again. Are you guys able to hear me?
This is Chris. I can hear you loud and clear.
Perfect. Okay, I just wanted to make sure. So we're going to go over now the enrollment into a CCO. My name is Mariela Sanchez, and I'm one of the care manager directors at Care Design New York in the Brooklyn region. We have different sources in which we receive referrals into a CCO. And one of the referral sources is from the DDRO, the front door team, from provider agencies that call us and tell us of someone who's looking and they need care management or CCO services. Transfers from other CCOs are some of the other referral sources that we receive. From schools, of course, referrals directly from the schools, community organizations, from social media and internet. Sometimes people contact us there directly from the social media, or from the New York City ACS-CT unit. The enrollment to a CCO OPWD requirements are as follows. You would need an AA tool, that is the eligibility assessment authorization tool, that is completed by the DDRO at the front door team. It identifies the services that are requiring care management. You also have another requirement, which is the person or the family outreaching, contacting the CCO enrollment team to begin the process. We have the OPWD eligibility, which is the LCD. This is a requirement, and we will need to get for that a updated annual medical for the year. You need an updated psychosocial and psychological evaluations for that LCD to be provided. A completion of the Maximus OPWD conducted CAS or CANS for children who are under 18, and Medicaid approval if needed. Parental deeming process for people under 18 in need of Medicaid, and this is necessary to obtain the waiver or self-direction services. Front door information session and or self-direction information session. And this one is actually key, the self-direction. It is very lengthy, the time that we receive for approval. So we do advise families prior to enrollment, if you already know that you want to do self-direction, to begin those information sessions at an early time. The completed DOH consent, and this one is completely managed by the CCO enrollment team. They assist the families or the individuals in completing the DOH consents. The DDR approval and processing occurs on the first of the following month via Choices roster. So if the person is completing the DOH consent and they have done all the other requirements completed in March, that means that by April 1st, which is the following month, the first of the month, then they will become accessible to the CCO in the Choices roster. There are some challenges, of course, or delays into the CCO enrollment, and these are the ones that we were able to acquire. Sometimes the AA2, but the DDR front door is needed, and that's also delayed, and the family hasn't completed the second step, which is the phone call. We have the DDR front door referring children waivers or FSS programs. Parental deeming process, of course, which is when the income is too high, but there's children, so they're able to still obtain Medicaid. That in itself takes, a delay into the enrollment process. We have the Medicaid enrollment process, the DOH consent completion for children as well. That one is very lengthy. Obtaining the required documentation in a remote environment. Sometimes families don't want to meet us in the home, setting up meetings at the office, but going into the field actually and obtaining it. Or they don't have the feature which they can sign electronically. So we would need to coordinate and meet with them in person. Special populations, OPWD expects the CCO to pre-assign to a care manager for people in certain settings. So people that are moving into a certified setting, for example, even though they're not completed with the enrollment process, they are pre-assigned to a care manager to assist with the enrollment. CCOs can help resolve enrollment challenges, and this is as follows. We have specialists within intake and enrollment departments, each of the 3 CCOs downstate. They provide linkage to family support services and other systems of care if needed. They assist with obtaining appointments for evaluations, all those evaluations that are needed for the LCD. They assist with Medicaid applications and other paperwork. If they come to any of the CCOs and they don't have Medicaid, the enrollment team is the one that assists with that. And they start the waiver enrollment process as well. Here are the contacts for each of the intake and enrollment teams. For ACA New York, we have 833-MyACANY, or you can email at questions@myacany.org. For CDNY, we have 518-235-1888. Or you can visit at www.caredesignny.org. Complete the enrollment services, which is on the website form, or you can actually contact Peter Coleman. He's the outreach and engagement manager, and his direct line is 518-580-3642. Or you can email enrollment@caredesignny.org. For Tri-County Care, we have the contact of 844-540-8400. Or you can email directly at intake@tricountycare.org. Now we're going to have Jason present what to expect from a care manager.
Thank you, Marilee. Hi, my name's Jason Mazuka. I'm Vice President of Care Management at Tri-County Care. Don't let the background fool you. I'm actually coming to you from Albany under about 2 feet of snow. So this is wishful thinking on my part behind me. All right, so following enrollment. All right, so after an individual has been enrolled with any one of the CCOs, we make initial contact with that person or their advocate and complete the care management checklist within the first 30 days. We also engage in a comprehensive assessment process. That would either be the IAM assessment or the PATHS assessment, depending which CCO you are affiliated with. Our initial life plan is completed within the first 60 days of enrollment into a CCO and published by day 90. And then we continue or initiate waiver service enrollments after an individual's enrolled with the CCO. Next slide. All right, so what does this include? As I mentioned, either an IAM assessment or a PATHS assessment, depending on which CCO you're with. DDP2 completed by the care manager every 2 years or as needed and by the waiver providers. The LCED, the level of care eligibility determination form, we do redeterminations annually within 365 days. And the CAS or CANS is completed by OPWDD or an assigned interviewer from Maximus. All right, so the care manager convenes the IDT, the interdisciplinary team. That includes the service providers and schedules the life plan meeting. The member should be present for their life plan meeting. Okay, it's their meeting. They should be present, and anyone of their choosing should be present. We do the assessments, the staff action plans, the self-direction budget. We assist with working on, and other relevant documents are reviewed at the meeting. We discuss at the meeting services, outcomes, goals, and which providers are going to be assigned to each of these. The draft plan is then sent by the care manager to the member and advocate and the IDT. If no edits, the plan is approved for publishing. The signature and agreement must be in writing. It can be a scanned attestation or email response, must have approval of the person and the family to publish the life plan. The providers need to review and acknowledge and agree to the life plan. The annual and semi-annual life plan should be published 45 days following the day of the meeting. All right, so goals, level of supervision, tasks and supports may be assigned to providers following the comprehensive assessment process, but should be reviewed for relevance and validity. The personal outcome measures and goals in the life plan are in general language and will not exactly match the staff action plan. This is not a billing standard issue. Staff action plans spell out how the provider will deliver that outcome that was agreed upon at the life plan meeting. The life plan should be reviewed with the staff action plan, and reviews can also be held early to avoid any discrepancies. All right, so the life plan is needed to apply for services. OPWDD authorizes the services and the approved units. The care manager will contact providers that deliver the desired service. The care manager can collaborate on the justification, the SARF or the RSA to get the services authorized. If a member already gets services, but they want to change or add a new service, number of hours, units, the care manager completes the SARF form and submits to the front door. The care manager is responsible for informing the providers of the waiver NOD09 or approval transfer letter. And again, we are responsible to send that to the providers. Any changes to services need to be reflected in the life plan and will require an addendum. All right, contact options, face-to-face visits. A care manager, this is how we define them. A care manager can talk to and see the person, however, does not need to be in the same room or space as the person. This could be done using video technology. In person means you are in the same room or space as the person and could reach out and shake their hand. Telehealth, COVID-19 regulatory relief is allowing use of video or telephone connection to meet face-to-face and in-person requirements. All right, everyone enrolled in the comprehensive care management gets a monthly contact. The tier level that's assigned is what determines the requirements for the visits. Tiers 1 through 3, monthly billable contact, activity, and quarterly face-to-face. and the annual and semi-annual life plan meetings in person. Tier 4 non-Willowbrook is a monthly face-to-face and quarterly in-person, annual and semi-annual life plan meetings in person. There's also a Tier 4 opt-out that each of the CCOs can utilize. It's been in effect for about a year now, a little more than a year, and we can provide additional information on that if needed. And of course, Tier 4 Willowbrook, there are no changes with Willowbrook. It's monthly in person every month, and the semi and annual life plan meetings are in person. Nicole mentioned in the beginning about the HCBS basic plan. So that is the annual and the semi-annual life plan meetings, which are held in person. They can meet 2 additional times during that year to address unexpected needs. Slide. And these next few slides, I won't read them word for word because I know we're pressed for time, but this kind of goes through what we mentioned before about the face-to-face requirements, the COVID caveat that's been in place for the past 3 years, and the use of telehealth modalities. Tier 4 non-Willowbrook, as I mentioned, these are monthly face-to-face meetings. Right now, during the public health emergency, it may be in person or through telehealth. There will be changes once we go back after the public health emergency is lifted. We are expecting that we know that the federal public health emergency is expected to end on May 11th of this year. And within 6 months, some of the regulatory relief that I've mentioned will go into effect. Okay, and now I will pause and turn it over to Crystal.
Okay. Good morning. Can everybody hear me okay?
Yes, Crystal, this is Chris. I can hear you loud and clear.
Great. Thank you so much. Thank you, Jason. So my name is Crystal Persida Sapienza. I'm a Director of Provider Relations at ACA&Y, and I will be covering the customer service, translation services, and other resources. Okay, so the CCOs have a customer service center. It's direct live access via phone and email to professionals. The customer service center is able to resolve concerns and questions, provide information, connect and follow up. It's open to members, families, providers, and anyone who needs to connect. The customer service centers at the CCOs operate during regular business hours, Monday through Friday, 9 a.m. to 5 p.m. And there is an answering service to handle calls outside regular business hours and on weekends and holidays. There's a ticketing system that tickets and tracks each call and email to ensure timely follow-up. When requesting member or general information, please provide the member's tabs ID or date of birth, and it also must be provided along with their member's first and last name. At ACA&Y, you can call 1-833-MY-ACA&Y, or you can email questions at myacany.org. At Care Design New York, you can contact the member relations contact at 518-235-1888, or member feedback at caredesign.org, or managed care questions at caredesign.org. And then at Tri-County Care, you can call 844-504-8400, or info@tricountycare.org. Next slide. Great. And then there are translation services available. So at ACA&Y, the Customer Service Center utilizes a language interpreter line in the event the caller speaks a language other than English or Spanish. And again, that number is 833-MY-ACA&Y, or questions at myacany.org. And then Care Design has a New York State OPWDD LSA, Languages of Limited Diffusion, LLD. Care Design New York Enrollment Department also has staff that speaks English, Spanish, Russian, Yiddish, Korean, Mandarin, and Cantonese. And you can also email member feedback at caredesignnewyork.org. Well, sorry, caredesigny.org. Tri-County Care has a customer service center, and that's customer service at tricountycare.org, or 844-504-8400, extension 0. Okay. And then there is a member relations department. which staff is knowledgeable of OPWDD services and programs and resources in the community. Staff who have similar experiences of navigating services and offer unique perspectives to members and families and offers peer support. Next slide. The member relations contact information at ACNY is Pamela Rice, is the Vice President of Member Relations, and Pamela can be reached at pamela.rice@myacany.org or 347-541-2028. Care Design New York has a member relations department, and that phone number is 518-235-1888, or you can email memberfeedback@caredesignny.org. They can also be reached after hours at 1-877-855-3673. And then Tri-County Care, you can speak with Christina Silva Soto, Director of Member and Family Engagement at c.silva/soto@tricountycare.org, or you can call 844-504-8400, extension 9745. And then there are provider relations departments. The provider relations teams works with key leadership at provider agencies to promote proactive communication, including regular connections with care management, identify service gaps, explore ways to collectively support members and their family, and advocate with one voice. At ACNY, you can email the general email at providerrelations@myacany.org, or for the specific contact of the Director of Provider Relations per the region, you can visit acny.org/providers. At Care Design New York, you can email providerrelations@caredesignny.org, or you can contact Bridget Berkler, Network Development and Provider Relations Account Manager at 518-801-7841. And then Tri-County Care, you can contact the resource team at tricountycare.org, or for the specific contact for Director of Provider Relations, visit tricountycare.org. And these are other sources that can be used. ACNY resources, they have a community resource tool that is available at acny.org/community resources, where you can search by category, service, or organization. Care Design New York has resources that have quarterly webinars that are held virtually, and then you can visit the provider resources page on their website. And then Tri-County Care, the care managers have access to a resource portal to assist in connecting with appropriate resources in the different regions. Please contact your specific care manager. And these are just additional resources. There's a map of the 7 CCOs and PHP catchment areas. If you want more information about CAS, there is a link. For ACA, we have our website and phone number, and as well as email. Care Design has their email, phone number, and website, as well as Tri-County Care, their website and phone number and email address. And now we can open it up to questions.
This is Chris Grive, Vice Chair. Brian, you can join me also. First of all, I want to thank you, all three of you, to be here. Before we open questions, I think we want to ask the Brian, do you have a question? Joyce, do you have a question? Or Deborah has a question? I see Deborah's head.
No, I don't have any questions. There were questions in the chat.
Yes, I know. I'm going to get to them right now.
Yes, I have a question. I'm on mute. Okay, hi. All right. The one question, and it could be also a comment, but I'm having families are having a hard time reaching you, and they're very frustrated and they're really upset. And I just tell them so what are you doing to make sure, and I'm asking all three of you equally, what are you doing to help the families when they're in the middle of a crisis or a problem? Because it is frustrating for these families. So whoever wants to, and also how about your, not just Spanish, and I know Care Design has a GHO that speaks the different Chinese dialects as well as different languages, but how are you handling people who speak different languages, not just only Spanish? I asked. Who's going? Did you all hear me? Chris, did you hear me?
Yeah, we heard you.
Yes.
Okay. Okay.
Yeah, I'll answer first from Tri-County Care's perspective. First and foremost, in the email signature of all our staff, so for our care managers, it should also include the contact information for their direct supervisor as well as their regional director. So if an individual or a family member advocate is unable to reach the care manager right away, they have the contact information for the next two levels there. Also, the customer service department that we talked about can be reached during regular business hours between 9 and 5. And, they will also, if they get a phone call from an individual or advocate, will connect them with the appropriate care management staff, whether it's the care manager, the supervisor, as I mentioned, the regional director, or if it comes up to, my level as the vice president. And we do have the after hours emergency hotline too. As far as the language one, we do have access to translation services if need be, but we also specifically try and hire to meet language needs. So I know our workforce speaks over 40 different languages. So we try and pair up a care manager that speaks that language with the individual that comes through intake. So I will pause there so Crystal and Nicole and Marilee can answer too.
Thank you, Jason. Crystal, I'm going to, hand it over to you, but many of the same things Jason spoke about, we also have at ACA, but Crystal is provider relations. I'm sure you can add to that.
Yes, sure. So it's really the same as Jason had mentioned. We also have the same thing with the care manager's signature. Right below their signature is the care manager's assistant director of care management, who is their supervisor. So that could be a great tool to use. We also have the customer service center at ACNY and the same hours from 9 to 5. And then we also have an after hours hotline. And then I believe for emergency services, we do have Nicole, I think the regional directors are assigned during after hours for emergencies, and they are available, I believe, on the weekends as well, should an emergency.
Yes, our emergency call center is manned by our regional directors and also our VP on a rotating basis.
Great. And then we do have translation services as well, should the need arise.
Hi, this is from Care Design New York. Deborah, one thing, maybe getting those numbers to those families so that they're able to contact us directly if they're having trouble. Similar to what Tri-County said, our emails, when we send emails out to providers and families, they do have the supervisor and the care manager director and regional. I don't know if maybe you want to compile, or I can send it to you for Care Design, who are those directors and regional directors, so that when they do reach out to you, you can give them a quick number, but the customer service one. In reference to the language and translation, we do have many. It's not just the GHO services that we have for the different dialects in Cantonese. We do have others that we do use, and it was part of the slide regarding those translations that we do. And we do support many of those languages that are very common in the Brooklyn region, and do pair them up the same with a care manager or a supervisor that is able to speak the language.
Yes, I would love for you, Care Design and ACA and Tri-County, as well as PHP, please send us separately that contact information, so we can set it up on the website and it'll be easier for us to get to it. And if you also have, for families who don't, because I get a family member that can speak English, if they contact us, we need to know who do we contact for the translation, or figure this out, because this is one of a big pet peeve of me. But I'm also get frustrated when a parent says to me, they said, I can't get service, I don't speak English. And I said, not true. If your child's an American citizen, yes, they can. You don't have to speak English in the United States. We don't really have an official language. It is never, so that's the big thing I want everybody to understand. but I appreciate you. Please send that information to us, because we also have a lot of the elected official staff are on this meeting. And yes, we want to share it with them also, because we do get parents going into their offices complaining too. So I want we to have all the correct information all around so people can get the right help they need. Sometimes if emergencies come, you can't, of course, always handle, but I'd appreciate it. So thank you. And I appreciated all your presentations. Thank you. And that's all I have. Brian and Chris, take over.
Or would you guys be okay if we shared your PowerPoint, if we put it on the website and emailed it out, since it does have a lot of the contact information? Okay, because I do see some people have asked for that in the chat. Typically we do that, but I just want to confirm first to make sure you guys are okay with that.
Thank you, Brian, for asking. Thank you.
I second your motion, Brian. Thank you, Brian, for also backing me up. There is one question I'm going to read. It's from OPWDD. Brian, do you see that as well? Just want to make sure. It's around 10:43 a.m.
Yes.
Go ahead.
So, Lucy had asked if you guys can clarify that you are not requiring the LCED and EAA before acceptance.
Yeah, that's where we said on the PowerPoint that we do have early enrollment where we do pre-assign before that process.
Okay, thank you. Then we have another question. Medical forms have been a big issue. They require yearly medical forms from the participants as part of the audit system. Are care managers responsible to help providers get these medical forms from parents or guardians?
I can talk for ACA. We do ask every member to provide an annual physical for us because we are overseeing all their care. So we want to ensure that they're getting all the services that they need, and one of them being an annual medical. So we do work with providers and we work with the families to get the physicals, and we can share them if requested.
I'm sorry. I was the one who asked that question, and
Can you
I
please
know that as a
can you
provider.
please identify yourself, please?
Sure, I'm sorry. This is Francesca Farron of City Access, New York. And our medical forms have certain questions on them, and they're a bit different or require more information because of the type of program. So is it that we can maybe possibly send you a copy of our medical form if we're having difficulty receiving these from numerous participants that are in, whichever care management company, and get these done, because it is a matter of audits also. And we did let everything, for COVID, it's been a couple of years of not getting them for different excuses and reasons and this and that. So now we're really trying to get all of our books in order and get everything back up to date with no more COVID excuses. So can we do that? Like give you our form that's required with this information?
Francesca, regarding Care Design New York, I advise you to also contact the provider relation. That will be helpful. Maybe we can edit our own medical form to update that to whatever it is that is required for you. That will be the best step to talk to them. In reference to your program and what is needed. You can provide to the care managers your form, of course, and that can be care managers for CCOs. We are mandated to make sure that people have well-being as well. And we do coordinate the annual physical appointments with the doctor and the individual, of course. So that will be helpful to have.
Thank you so much.
All right, the next question was from Rochelle. I guess as family members struggle to get staff action plans or not even know what staff action plans are from their providers, is there any assistance from CCOs in helping the families get those documents when the providers aren't providing them in the time that they're supposed to or at all?
This is again Marielle Sanchez from Care Design New York. We are mandated to actually have them on file as well. So you can ask the care manager to provide you that staff action plan. We have to have it after the life plan meeting is held. We have 45 days to complete and publish the life plan. So the provider agencies have 15 days after we distribute the life plan to give us the staff action plan. So we do have it on file. Speak to your care manager. They would be able to facilitate, either mail out a copy to you, bring you a copy, or email it to you if that's the case.
Yeah. If I could just clarify,
Go ahead, Rochelle.
it's not, this is not a personal issue for me. I'm one of the co-chairs of the advisory board at Care Design, and I have very good relationship with my providers, and I'm fairly knowledgeable. But there is a general complaint that of the people not receiving the staff action plans, because there's actually, as far as I know, no OPWDD requirement that they be distributed. And there's no process. And especially because they come in after the life plan, which makes sense because they have to be consistent with the goals. But a lot of people don't even know enough that there is a staff action plan, so they don't know to ask for it. So this is actually perhaps more of an OPWDD question, but I would encourage the CCOs to be mindful of this problem. And I think it would make sense that since you are required to get the SAPs, that the care manager, somehow that it automatically gets forwarded to the family members, just the way the life plan does. Not that they have to sign it or return it, but at least that they have the information.
And Rochelle, I can just say again, I know I had messaged you privately, but from the provider side, there definitely is a requirement. I run Dayhabs, ComHab, Respite, and now Respite doesn't have staff action plans, but we are audited on that. We have to show proof of distribution from our programs that we distributed the staff action plans within 60 days, or like the CCO said, 15 days after receiving the life plan. So we definitely are followed on that and audited for that. And I know for a lot of providers, that's one of the biggest areas of citations, the lack of distribution and proof of distribution when plans are created.
Seems to be honored more in the breach than the observance, but thank you for that information.
You're welcome. All right, there's a few more questions in the chat. Matthew from YI asked, at this point, are all 3 CCOs able to conduct the necessary evaluations for eligibility through their own clinicians? If so, at what point are these clinicians utilized rather than outsourcing to outside agencies?
Well, I can talk for ACA. We are not able to do all the evaluations needed, but we do have our Care Connection team that would help the families find the resources that they need to get the evaluations done.
I would say the same for Tri-County Care. Yeah.
And for Care Design, is based on the enrollment team. They're the ones that know which evaluations are needed and send referrals. And is basically the way it was described to me is sent to whoever has placement at this time. So they don't have to wait too long to get those evaluations completed. But definitely we're using outside agencies. We're using outside agencies, of course.
Thank you so much.
Brian, this is Chris. I do have a question, but it's not in the main chat. It's in the private section of the group. So I'm going to read that question since it's the only one. It's a simple question. Just want to make sure, Brian, you can hear me?
Yep,
okay,
I can hear
just
you.
making sure. The one question they're asking again, and I think you guys are aware of this question has already been brought up. Can you all 3 put your information into the chat? That's what they're asking for a basic phone number and a basic email address. I'm guessing I'm hearing the typing, so that answer would be yes. That's the only question I have from there, Brian.
And I don't see any more.
Yeah, there is.
There's more questions.
Deborah Grive, chair of the advisory, has a question. She's trying to raise her hand, but her system is frozen up. Give me a second. There you go. There you go. No, you're still muted. No, you're still muted. Oh no. Oh no.
There
Yeah,
you go.
there's a. Yeah.
Can you hear
Yes.
me?
Yes.
Okay. Can we please also call on PHP? They're here because I would like people to know if they, because many of our individuals have Medicare and Medicaid because of them being disabled before the age of 22. So I know they're on, and I just saw them put something in the chat. So I think we should just call on them for them to give a brief explanation of what they do. Can you hear me?
Yes. Hi.
Okay. Is that you,
Hi.
Nick?
It's me. It's Nick
Hi.
Laguna from Partners Health Plan. Hi.
Hi.
So we provide case management or care coordination as well. We're a separate option from one of the CCOs. Right now, we're only for people with Medicare and Medicaid who have the intellectual disability, of course, and in our downstate regions. And we have a little bit of a different structure with some differences. I explained in the chat that for most new services, you do not need to go through the OPWDD front door to approve the service. We do authorizations right on the life plan. So for most new services, this could lead to a quicker start for the service. There are some exceptions like residential placement, because that's a whole nother animal that you do have to go through the state. And we also provide a 2-person care management team. We provide a care manager, and in addition to the care manager, we have a clinical team leader, and they both work on the caseloads together and attend the life plan meetings and advocate. Our clinical team leader is a registered nurse or a licensed social worker. Is there any questions, particularly with PHP?
This is Debbie. Nick, can you please explain that there's certain hospitals you don't, or plans you can't work with, like if the individual goes to a health and hospitals corporation, what do you do when the individual has a doctors that are there and they've been using them for years, and what do you do for them? Or can you do anything for them?
Yeah, so like any insurance company, we're a private insurance company. Any insurance company, public or private, the doctors have to accept the insurance that you go to. And there are certain doctors that are obviously not in our network. And, like with Medicare and Medicaid, there's some doctors that don't take Medicare or Medicaid or some other Medicare Advantage plan. So specifically what Deborah was saying is that the New York City Health and Hospital Systems is not in our network, which means if you go there for an emergency, that's one thing, that's covered. But if there's a doctor that is their only main affiliation for admitting privileges, there's a good chance that doctor is not going to be in our network. There are on occasion some workarounds, and that's kind of a case-by-case basis. Sometimes a doctor has additional admitting privileges to other hospitals as well. But if you want to learn more about our network, there is a search tool on our website to look for doctors that are in our network. And if you wanted to learn anything more about PHP, and I could certainly assist with looking at a specific doctor or doctors to see if they're in a network to see if it would be a good fit for you, because we understand that you want to if you have a specific doctor you like to see, that you want to continue to see that doctor, and we would look into the possibilities of maybe even getting that doctor in our network, because we do that too. We're always looking for new and good doctors.
Oh, well, thank you for explaining that. And yes, many of my families who their children go there because they did start it in the child developmental centers, and their doctors have been caring for them since they're young. We will still be advocating for them to accept you in their network, but also My other question is also for the other CCOs.
Once she's done,
The
then Brian.
what do you do about dentists for
Then
our
Orlando.
population, for the children? Do you also work with the NYU Dental? Do you work with the Bellevue's Dental, Kings County's Dental Clinic? Coney Island has one, but you have to wait more than a year for an appointment. But do you work with a couple of the networks I just mentioned? So I'd like to know from all three CCOs, PHP and after them, okay?
And excuse me for one
And excuse me for
second.
one
After we
second.
finish, we have a person's hands up, and we got to move on
and we got to move
from
on
that.
from
Because
that.
we have a lot of questions.
Because we have a lot of questions.
Yeah, good. But can they just tell them which dentists, which dental services do they work with?
So we do have a Care Design, a provider portal. Sorry, do you guys hear me?
Yes, I can.
This is
Okay.
Chris.
So
I
we
can
have
hear
a
you.
provider.
I can hear you and hear you.
Okay, we have a provider portal in which the care manager has access to it. And from the two that you have mentioned, they do come up and they have. We will have to contact those clinics directly to find out regarding the appointments. It's not live in that we can tell like how long is to wait for the appointments, but they do have it and it's sorted by borough. So I can, even though I support someone in Brooklyn, if the family is okay going to Manhattan, that's more than okay to make the referral there.
Okay, thank you.
This is Crystal from ACA NY. Same thing, we do have a community resource tool that our care managers have access to, and you can search by service. So just looking at our site, you can search under medical resources, and then there's a list below where you can search by, you can click dental, and then it's sorted by location, and then the care managers would have to just call and verify that they accepted the Medicaid.
Thank you. Tri-County.
I'm sorry, I'm dealing with the crisis on the other end, so I have to be muted for a second. I apologize.
Okay. Put it in the chat then. All right.
Okay.
We
have Orlando representing Congresswoman Yvette Clark.
Chris, you're echoing.
I know there's too many microphones
on.
Hello, everyone. How you doing? My name is Orlando Ross. Thank you for this opportunity to speak with your organization. Thank you, Ms. Grief, for inviting me. Chris, also for inviting me to this conversation. I'm going to be really brief. I work with Congresswoman Yvette Clark's office, and we are in the process of doing a community investment, how would you say, for grant opportunities. I'm going to put the information, it's already in the chat, but I'm going to repost it so that you can go in and actually access this information. The grant opportunities that they're offering right now has to do with workforce development, has to deal with infrastructure bills or infrastructure opportunities, anything dealing with housing information. That's what they're doing right now for the congressional funding process. We are also going to be doing a listening tour throughout the congressional district of 9th congressional district. If you happen to live in any of our districts, whether it be Community Board 8, whether Community Board 14, 17, 18, 15, 11, 12, please reach out to us so that we can coordinate and get you guys into that meeting so that you can have an opportunity to speak directly to the member. I'm not going to take too much of your time. My information is in the chat. Please reach out to me. Deborah, I will definitely send you the invitation. If you can let me know what community board you guys are in, I can make sure that your organization is included in the invitation, and so that you guys are aware of what's going on. And I'll make sure that it's ADA compliant as well.
Thank you. 15.
You're in 15? Okay, so we will definitely be talking to you soon. Okay, have a great one. And please, the invitation to apply for the congressional funding, it will end on March 17th. We did send it out to a whole slew of people in our catchment areas. If you did not get it, my apologies. You can always text me, and then I'll send it directly to you. again. Okay, it's all my information is in the chat. Have a great one.
Thank you, Orlando. It's good to see you from the computer screen.
All right. Do we have any other questions?
Brian, there's still
for the CCOs.
Yeah, there's
I see.
I'm sorry to interrupt you, Brian. We do have questions in the chat. Needs to be read, and that's it.
All right. There's a question from Jackie from NICID. Is there a scheduled training for care managers across the CCOs in regards to the ever-changing FSS reimbursement policy? The state has been updating the allowable and non-allowable items each month since December.
So for Care Design New York, for care managers, we have Thursday lessons. They're done weekly, and that's where it's reviewed any changes. And we have either guests that come and invite or experts in the field that do present those changes and the ones that we're not going to be receiving reimbursement.
For ACA, we do have a training that's actually being released today for all care managers.
We do internal training here within Tri-County Care on it.
Thank you. And then Matthew at YAI, are the care managers able to complete psychosocial updates that can be submitted to apply for new OPWDD services?
For ACA, yes, we can.
All right, thank you. Chris, do you see any other questions on the private chat on your end?
At this time, there is no questions in the private section. And I think we're all good from here.
All right, so again, I want to thank all the representatives from the CCOs. It was very helpful and insightful. I'm sure we'll get some questions after this ends. People were a little shy to ask or other thoughts pop up. So I'll email you guys if anything comes up. But we definitely appreciate you guys coming together for that presentation. Brooklyn definitely appreciates it.
Thank you for inviting us.
Thank you.
Thank you.
Thank you.
Guys. Thank you,
Thank you.
And Brian, thank you also. I think we all agree. I know Joyce had to run, but I think this was really well done. And I think we have to say thank you to all three of them. I think this is a great presentation. It was an excellent presentation. I think you encouraged Ms. Greif as well. And I can't.
Okay.
Yes.
Can you hear me? Okay. Yes, I want to thank all three CCOs. I also want to thank PHP, but I do thank the CCOs who did come. And I also want to thank you for something even more important. You all work together as a team. It was very well. We appreciate it. I'm also going to put it in the chat. So thank you all. I appreciate you work together. And I also thank PHP for presenting. Thank you.
Yes, thank you. And thank you, everyone. Let's move on to our agenda. I know we had Orlando had to run. He did his report. Do we have any other elected official representative here that want to make their announcement first? I know we had Roxanne Prasad's representative here. If she can unmute. Just check.
Hi, good morning. My name is Ms. Strong from Senator Prasad's office. Just want to say thank you for this presentation. It is definitely the community is really important to Senator Prasad, and Senator Prasad, when she goes to when it comes to budget and so forth, that your concerns are also brought before her. Just want to let you all know that if you ever need our office, please feel free to contact us at 718-649-7653. Again, our number is 718-649-7653. I also will put my information in the chat if you would like to speak with me. Thank you again.
Thank you so much for being here. Do we have any other representative elected officials here? Otherwise, I'm going to move on quickly so we can get to announcements. And just to remind everyone, since we did not do a committee report, we're going to be skipping that a little because of time. So I'm going to give an update reminder to everyone. The next family provider meeting is scheduled on April 12th. As you see, the meeting code is there. So as Deborah mentioned her report, which was a really good attendance meeting like today as well as the other day. Please note the Transition Committee meeting has moved their date to next Thursday, the 23rd. So as a reminder to everyone, that email did go out and it's on our website. It's been updated. So the transition meeting is not meeting tomorrow. They're meeting next Thursday. Same code, same time, 10 a.m. And I remind everyone, our next joint meeting is April 26th. As a reminder, please visit our website to check all meeting schedules there as well.
Forget it. You're acting up.
Okay, Madam Chair, we can definitely hear you. As a reminder to everyone.
Muted.
Okay, as a reminder that yes, there was an opening on the R211 train. It is running right now on the A line. It does have the cameras. It is working. So please make sure if you see that train, please get on and enjoy the ride. Cameras are there. The accessible seatings are located on all 10 cars, but the bigger part of the accessible seatings are more on car 1, 5, 6, and 10, where the drivers are supposed to be and the conductor. And a reminder to everyone, we did open another couple more customer centers. This is one for Jackie in Staten Island. St. George is open. People in Queens, Main Street, Flushing, and another one in Manhattan at Penn Station, 34th Street. As a reminder, these are open and more will be coming up soon. And remind you, don't forget Omni. And as a reminder, if you have announcements or anything you'd like us to put on the website, please email us on that email address. On that. And there's our phone number and information from 9:30. You know, our office number is available. We do answer calls between the hours of 9:30 to 5:30 p.m., Monday to Friday. So at this moment in time, does anyone have any questions for me? Or I'm going to move on to the announcements. If anyone has announcements, please have your hand raised ready so I can call on you so we can then proceed. We're right on schedule today, and I have to say we're moving very well. So I'm going to start with Carrie Banks.
Thanks so much, Chris. I appreciate it. Hi, everybody. Happy Ides of March. So the library has some exciting things going on. We are partnering with Fate and offering two workshop series. One on raising children with disabilities, and then one called the Circle of Security. And that's a series of workshops, parenting series that meets the requirements for court-mandated parenting classes. So if you have people you're working with who need court-mandated parenting classes, the Circle of Security model is available at the Brooklyn Heights Library. If someone misses a session, because we did start today, if someone misses a session, they can make it up. But you know, completing the session will complete that aspect of their requirements for courts and custody issues. At the same time, we're running a parallel one on raising exceptional children. I put the two upcoming workshops in the chat if you're interested. And other than that, we've got coming up a Music for Autism concert and a very exciting announcement, which is that in April, on April 29th, we are going to be back in person with Music for Autism at the Brooklyn Heights Library. And I'll tell you more about that later, but mark that date, April 29th. Back in person with Music for Autism. We are very excited about this. And also, just to let you know that will officially be part of the Real Abilities Festival, New York City Festival. And of course, that's the festival that celebrates media portrayals of people with disabilities. So join us then. And in the meantime, catch up on the parenting workshops. Of course, we still have our drop-in workshops, and you can find more on our website, which I will post momentarily. Are there any questions?
Carrie, just letting you know, I got your email that you sent to me on the advisory, so thank you for doing that. I will pin that onto the website as soon as possible.
Yeah, and Chris, I think you have this other information. I think that Zadine Richardson sent that to you earlier in the month.
Yes, and I was.
Would you like me to
Yeah, resend that to me. I'll make sure it's on the website. As a reminder to everyone, I do ask everyone to email it so I can copy and paste it so it's up to date. Thank you, Carrie.
I will take care of that.
Mm-hmm.
All right.
Thank
No questions?
No, there is no question unless Brian or Deborah, do you have a question for Carrie?
Just a side note, Deborah, I chatted you. You're muted, Deborah.
She wasn't until now.
Oh.
What? Yeah.
Okay, that's all right. So just get in touch with me later. I chatted with you about the trying to get space in the library for the council meetings, and I'd love to talk to you about that. All right. If there's no questions, I'll sign off, and I do have to leave a little early today because I have another meeting. So, but thank you all. It's so great to see people, and I'm really looking forward to when we're back in person. Thanks. Take care.
Thank you, Carrie. Okay, iPhone, can you please unmute yourself and please identify yourself?
Hi, this is Jackie Tripodi from NYSED. I just want to make sure that families are aware that there are funds still available for family support reimbursement. And we are more than happy to work with the CCOs to help understand what families do need to submit for that reimbursement. And I did put my information in the chat.
Thank you, Jackie. And Jackie, you did hear me saying that St. George's Terminal has the customer center now open.
Yes, I did hear that. Thank you so much.
And you don't have to go to Manhattan to go to Stone Street. You can go to St. George.
Good. That's easy. One train.
Or a bus.
Or a bus.
Or a car, because you can park near there.
It's a challenge, but yeah, you can.
Yes, you can. I've seen it.
Mm-hmm. Yeah, you could park, but you don't want to get a ticket either.
Yeah.
There's that little caveat. Thank you.
You're welcome.
Sandy Neighbor, I know usually your hand is up, but I did not see your hand, so I'm calling on Sandy.
Yes, thank you very much, Chris. I appreciate it very much. I do have announcements today, so I'll begin. I'd like you to know about 3 very exciting workshops that Adapt Community Network is presenting. There's one this coming Tuesday, March 21st, from 10 a.m. to 11:30 a.m. Lindsay Beal, occupational therapist and author, will be presenting sensory smart strategies for real-life challenges. Also on Thursday, March 30th, 10 a.m. to 11:30 a.m., we're having Harlow Rudolph, speech pathologist. She'll be presenting speech and language milestones, red flags for a communication delay. And last but not least, on Thursday, April 30th, 10 a.m. to 11:30 a.m., we're going to have a webinar, Self-Direction, Navigating OPWDD, and Family Involvement. Jessica Caravallis, independent self-direction startup support broker, will be our presenter. Spanish and Mandarin interpretation will be provided for all of these webinars. Registration is required. To register, please email familyconnect@adaptcommunitynetwork.org or call 718-436-7979, extension 714. Thanks very much, everyone.
And Sandy, congratulations of speaking on the legislative. I did see the video. And just to let everyone.
Very well done. Thank you.
Thanks, guys.
Yes, and just to let everyone know, the video, as I said, as Joyce heard me say this, and I'll say this again, it is on our website. So please get a chance to watch the video, and please keep continuing advocating for making sure all services, that's including transportation, healthcare, the CCOs, everything across the board. Let's please make that very clear. And now I'm going to check. Does anyone else have an announcement? Matthew from YAI.
Hello, everyone. Hi, Chris, Debbie, everyone. This
Hi.
is Matthew with YI Link. So we do have our Transition to Independence program is usually for Manhattan families. However, there are 2 out-of-borough spots. So if anyone is interested in kitchen skills or life skills or yoga mindfulness, the program is meant for those in their age range of 17 to 21, and they have to have an autism diagnosis with an autism evaluation. And they don't necessarily have to have OPWDD eligibility because this is a DOH-MH grant. So if you have anyone in that fits that age range and with the autism diagnosis, please, just give us a call or email for more information. We also have ballet, yoga, and social skills for the kids, ages 4 to 10 for the ballet yoga, and the social skills is from, I believe, 5 to 12. We're continuing our clinic is doing psychologicals and psychosocials and autism diagnoses and evaluations for people with Medicaid. However, I do believe we've exhausted our free evaluation grant. We may have like 1 left, but I think that 1 spot may be pending. So yeah, and just really give us a call or email for any questions you just might have, and I'll enter in the information in the chat box again.
Thank you, Matthew. Anyone else have a question for Matthew? Okay, I know I heard that. Thank you. Let me get Brian from Heaven's Hands. Can you have an announcement?
I put it in the chat, but Heaven's Hands does have a couple of spots left in our With Walls Day Hab programs. We are open at full capacity. We have 2 from transportation. We also have openings in ComHab, but that's a little trickier just because of the staffing crisis. So if you do have staff that you want us to hire, that would speed up the process. And you can contact us by going to our website, hhcsny.org, or emailing intake@hhcsny.org.
Brian, there's a private section chat question for you. They're saying thank you for today's presentation.
You're welcome.
This is not just for, and they're also thanking the whole entire council because this was fantastic. They have never seen such organized, such teamwork. I'm just adding the word teamwork because it's better to say it because they're saying gun ho, which stands for teamwork. So this is something that the 2 groups that are on, they are very, very happy. So I just wanted to share that. That just came up now. So I will say A+ across the board. Thank you, Brian. Okay. Does anyone else have an announcement? And Deborah's writing thank you, so everyone can see that on the chat. Let me just
Finally, it went through. Finally.
Yeah. Thank you. Okay. Let me just change. Give me 1 second. Is anyone from 2023? Can you please identify yourself? Or I'm going to say, anyone other agency have an announcement? Please say it now. Say your piece. Because I think I hit the new time record in meeting history.
Hi, Christopher. This is Angelica. How are you?
Angelica. Oh, and I can see you too.
So, you too.
Yes.
So we have open in our day have without walls. COM have a respite program in Brooklyn as well as Queens as well. But we mostly have a lot of openings in our Brooklyn program. I did upload my information in the chat. If anyone is interested, they can email me. I'm going to add my email information again and my phone number that they can reach out to me. We do not have a waiting list. We do have staff available. And for a day have, we do drop off and pick up with the family. We also have an overnight respite that runs once a month with the individuals.
Thank you, Jellica. Before we proceed, does anyone have any questions for Jellica? I know I'm hearing somebody must be ringing my bell, but that's okay. Just want to make sure no one else has a question for Angelica. Okay.
Thank you, Angelica. This is Deborah. Thank you for that announcement.
Thank you.
You're welcome.
Okay. Since Angelica just put that into the chat, and I'm going to ask for the last time, so I'll make it even. Does anyone else have an announcement? Please identify yourself. Or has a question? Otherwise, I'm going to say this word. Very simple. As a reminder to everyone, our next joint meeting is April 26th. Same meeting ID code number. Same time we try to start exactly at 9:55, which we did today. As a reminder to everyone, the next meeting is the fourth Wednesday, back to a normal routine, April 26th. So I do want to wish everyone happy Passover, happy Easter, happy Ramadan. If I forget any other holidays, forgive me, or anyone's happy birthdays to people, please.
Happy St. Patty's
yes,
Day.
thank you.
Today's St. Patty's
No,
Day.
it's Friday, Lati.
Oh, that's
Lati,
right. Apologize.
It's Friday, Lati.
Because then I have to change.
Yeah.
Gracias. Thank you,
Yes.
Milad.
Yeah. So on behalf of both councils, we want to thank you for coming to today's meeting. And as a reminder, please make sure you visit the website for any new updates that we get. On behalf of both councils, and I know Brian, you're here. Any last words? And Deborah?
Nope. Just thank you, everyone.
And I thank you too, Brian, for organizing this. This was excellent. Great job. Thank you.
I second that emotion.
You're welcome.
So on behalf of both councils, thank you everyone being here. And as the attendance today was high, just like they provide information, thank you for all being here. Have a wonderful day. Bye, everyone.
Thank you. Bye.
Bye, everybody. Bye.
Thank you.
Bye. Thank you for having us.
Bye.
You're welcome. Oh, now you're freezing. Now you don't want to leave. I don't believe this. Make me leave.